Hi, we'll talk about the prognosis or the scope of treatment using homeopathy for LPP, that is Lichen Planus Pigmentosus. My name is Dr. Rajesh Shah. I'm a director of Life Force Homeopathy. We are based in India, but we treat patients from across the world, currently 180 plus countries. And we have some good experience using large number of cases of LPP. So my suggestions for prognosis are based on our experience of having treated significant number of patients of LPP. LPP is a pigmentary disorder in which one develops pigmentation or hyperpigmentation or dark patches on the skin that can affect on the face, on the cheeks, the entire face, on the neck, on the back, upper chest. It can affect the arms, hands, and even the entire body. LPP is a form of lichen planus and it is an autoimmune disease. It is more of a pigmentary problem. It does not, fortunately, affect internal organs so much. So one does not have any internal suffering with this disease. However, it poses personal, social, cosmetic challenge to the patient, and so it has a big impact on the lives of people who suffer with LPP or Lichen Planus Pigmentosus. Its causes depend on, of course, autoimmunity, genetic factors, hormonal factors, stress factors, environmental factors, and so on. What is the scope of treatment, chances of recovery using homeopathy in LPP? Well, I would say LPP has some chances of recovery. The scope of treatment using homeopathy should be well defined, and I would say that it is not possible in every case to recover the cases of LPP fully. Unfortunately, full recovery happens only in a very few patients, and by and large, we are able to reduce the pigmentation to a certain extent. The certain extent could be relief in 10% to 40% recovery in making the spots lighter. In other cases, the scope of treatment is essentially to slow down the progression of the disease. The disease is progressive. The disease otherwise tends to increase and spread over larger parts of the body. And even if we can reduce the spread, even if we can slow down the disease progression, that also is an achievement. And in our experience, we have seen that homeopathy is able to slow down the disease progression significantly in most cases, if not all, of LPP. Many patients ask if chemical peeling or laser treatment helps LPP. In our experience, we have found that since LPP is an internal disease which is governed by the internal hormonal immunological factors, so any amount of external therapy or cosmetic therapy by peeling or laser will have very limited scope, and we do not recommend such therapy to the cases of LPP because that actually unfortunately does not help. Is homeopathy recommended? Yes, homeopathy is strongly recommended for the cases of LPP because there is no other major treatment available except certain forms of immunosuppressants which also bring about temporary and partial relief. So I would say homeopathy is strongly recommended for most cases. What is the duration of treatment with homeopathy? I would say the duration is long because it is a chronic, progressive and obstinate disease. So the treatment may be required for 1 year to 3 years or even longer depending on the cases. So I hope this video helps the patients suffering with LPP as well as the practitioners, the medical fraternity as well. Thank you so much.